So a question was asked, what to do when a crown breaks? And that, well, honestly, that depends. It certainly is an easier task if the crown was 20 years old and it broke. Odds are we're going to simply just replace it with a modern material. The materials that we're using today are very much better than the materials we used to use. And if we got 20 years out of the previous material, we certainly should expect something similar for the next go-round. If the crown was something that we just placed last month, then we have to do a little bit of detective work and figure out, why did it break? Did it break because of something that we did? Is it something that you did? Is it something the lab did? We need to figure out what's going on. Sometimes it's a bite issue, and we didn't manage the bite forces very well. Sometimes it's a problem with you and the way that you're handling your crown, the way you're either chewing, the way that you're biting into things, or perhaps the way that you maintain and clean the crown. Most of the time, though, the materials that we're using today are so strong and durable that fracturing of a crown is really not much of an expectation. Usually when things break, it's not usually the crown that breaks. Quite often it's the tooth underneath that breaks, and that becomes a bit more of a challenge. The challenge being that crowns require a certain amount of bulk and shape to it in order to remain and stay put. I like to describe it kind of like two styrofoam cups that are inverted. The one fits inside the other, and there's a certain amount of suction that is created, and that is going to mechanically hold on to the crown is going to stay in place. We use cement to help with that mechanical retention, but the shape and design certainly aids in staying put. If it breaks off at the gum line and there's just nothing left of the tooth, we used to be a little bit more heroic. One could be what I call a herodontist and try to do a root canal, build it up, and put a crown over the top of it. Those usually don't last as long as people think they would or should. And so then the hero becomes the victim. I look bad because all that heroic efforts that I went through to try to save this tooth really were fruitless, and the tooth should have been extracted to begin with. So don't shoot the messenger. The hero becomes the victim. Don't get mad at us if we acquiesce and do as you ask and try to save the tooth. Quite often we recommend you pull it and you ask us to do otherwise. So sometimes there is no solution to the broken crown other than remove the tooth and do an implant or a bridge or a denture or whatever the next step would be. This is also the reason why when people call and the dentists are reluctant to quote a fee, because many times people will say, well, how much for a crown? We might quote a fee. We try not to, but we might quote a fee for what a crown is. But then when the person comes in and we find out that, well, yeah, that's the fee for the crown, but you also need a root canal, you need a build-up, you need a post, who knows what else. Or maybe you needed the implant and whatever else that's going to go with it. And you might not believe this, but people insist that it's unethical for us they call it bait and switch. They think that we got them in on a low ball number and upsold on other things. Myself and many other similar colleagues just simply refuse to quote fees over the phone because there's too much variability. So the best thing to do when you break a crown, go see your dentist, have them take a look, and see what your choices are.
Dr. Timmerman is known internationally with licenses in multiple states in the United States, plus Belgium and Dubai, for cosmetic, implant, and sleep dentistry, with fellowships in the International Congress for Oral Implantology and the Academy of General Dentistry, and a diplomate in the American Board of Dental Sleep Medicine. If you would like to become a patient of Dr. Timmerman or simply have questions, please go to our website, www.drtimmerman.com. That is www.drtimmerman.com. Or call us at 206-241-5533. Or you could email questions for an episode of a future podcast at thewholetoothpodcast@gmail.com.